Coles, a GP, and when we talk about the crisis in the NHS, and particularly when we talk about those flooding through the doors in A&E departments, emergency departments, and clogging them up and making it congested, very often, and certainly from the government's point of view, it's the fault of the GPs, isn't it?
No, it's not the fault of the GPs. GPs are struggling too. They're at breaking point. They've been given a limited funding, and that funding was reduced significantly by the government scrapping the minimum practice income guarantee. So with limited funding, they've had to provide services to 64 million Brits. Now, I know personally many GPs in their 50s have succumbed to poor health from burnout, stress. They've suffered from brain hemorrhage, heart failure, and even suicide, which is so tragic, and it really breaks my heart because I know this GP personally, which means the bulk of the NHS general practice is being run by GPs in their 20s to 40s, and they're telling me they're stressed and burned out.
Okay, they're stressed and burned out, but what about the staff in A&E and having to pick up the slack? Because time and again, throughout the course of today, our correspondents and reporters and presenters up and down the country have said that they have come across patients walking into A&E who did not need to be there, that should have been getting that basic triaging at their local GPs.
When we look at GP appointments, we have patients who definitely need to see their GP, but we also have what's called time wasters, or people who come in with trivial problems that could be dealt with either self-help or at the pharmacist. We also have patients who do DNA, don't even show up for the appointments. In fact, one GP told me last week 3 people DNA'd in a row. So we as a country have to work together. There are a limited number of GPs right now. There are more GPs leaving than entering the profession, and a lot of GPs are going to Canada, Australia, Ireland, now even Saudi Arabia. They're saying that's even better than the NHS. So we have to work with what we've got. We've got fewer GPs, limited funds. It's not even enough for the minimum practice income guarantee. It's not enough to run a practice, so they're underfunded and trying to be safe. So, and to blame GPs is awful. It's just pushing the remaining GPs over the edge. I mean, they're already burdened by micromanagement, by paperwork, appraisals, revalidation, CQC inspections, for regulation. I mean, there's just so much on top of seeing patients.
Well, given that the stresses that GPs are under, and the fact that you're saying in so many cases they're underfunded, and the reality is there's not going to be any more resources given to GPs, do you think that the government is in a very difficult position because they want to try and spread some of the burden away from A&Es? They want to introduce a 7-day-a-week NHS, and they're coming up against a brick wall from GPs and other junior doctors as well, saying they don't want a 7-day-a-week doctor's service. So what is the answer? Something has to give. There has to be some change to the current structure of the NHS, doesn't there?
Absolutely. The government has already told me that to even say that they can't fund the NHS the way it is, I mean, it's like a black hole. There are so many advances now, bionic eye, dialysis, transplants, all sorts of things cost money, and we can't keep throwing money at a service that's free at the point of access, because it'll be flooded, and it is flooded, and now it's open to the EU as well. So we can't keep raising taxes. I know they've talked about, oh, let's increase the tax. That's not the solution. We've got to look at systems that are actually working. Where are these doctors and even members of the public going? They're going to Canada and Australia. Why? Because it's working. They're happy, they're safe. It's a system using semi-private care, co-payments, etc. Let's look at those models and see if we can adopt that, because what we have at the moment is not working. And I don't want to see patients where they have relatives who are dying in hospital unnecessarily, needlessly, or GPs committing suicide, or even junior doctors. I don't want that. It just breaks my heart. I can't stand reading about it and seeing it and knowing about it. We've got to fix the problem.
Okay, Dr. Una Coles, thanks for flying the flags for general practitioners. Good to talk to you.